Hi, I'm Harry Rock, and welcome to another edition of the Westfield Council on Aging Presents. This is a collaborative effort with Mike Squindo, Executive Director of the Westfield Senior Center, Tina Gorman, COA Special Projects Coordinator, and Pete Coles, producer of the WCPC Westfield Cable Channel 15. Our topic today is joint health in older adults, and my guest is Tim Rice, who is a physician assistant at Westfield's new Ortho MA walk-in orthopedic urgent care clinic. That's a mouthful. Here in Westfield, and I've heard that they've just opened up in...
Not quite yet, in Wilbraham. In early 2026.
Okay.
So for the Westfield, it was June.
So you've opened up here in June.
June, yes.
So we're going to be discussing, and I think everybody here can relate to this today, is we're going to be discussing achy and stiff joints as part of the natural aging process with arthritis and tips on how to manage it. I'm going to enjoy this myself because I got plenty of arthritis myself. So Tim, welcome to the show. We're really excited to have you here, and I didn't even know that we had an ortho urgent care center, urgent care center here in Westfield. So I'm excited about it because I want to learn everything I can. But I always find it interesting for our viewing audience to get a sense of just who the guest is.
Sure. And
a little bit of your background, where you grew up and where you went to school. I understand we have a certain school in common here.
We do, and with Westfield as well. So I grew up in Springfield, graduated from Cathedral High School, and ended up going to Westfield State.
All right, we love Westfield State.
So graduated there with a degree in biology and chemistry, and wasn't exactly sure of what I wanted to do, and ended up being introduced to somebody who was a physician assistant, and I spent some time with them and learned about it, and I said, this sounds great. And so ended up getting into Springfield College, where
yes.
Same for this, and ended up graduating in 2002, and have been working in the field of orthopedics since then.
Wow. What is it about this field that you get meaning and purpose from, and you enjoy working, obviously?
Well, I guess this is it's a field of medicine that if you enjoy working with your hands and you think mechanically, it makes sense as far as for what to do. There's the biology and the physiology of everything, but honestly, it's a lot of mechanics.
Right.
So for all of this, it makes sense, and it's something that affects everybody, as you can personally attest to, and I can as well. This is the kind of thing where it becomes very important and affects your everyday life quite a bit, and sometimes more than you'd like it to.
Do you have arthritis yourself at all? I mean, you look very young to me.
That's very nice of you to say. But yeah. So I have some early arthritis, a couple places in my hands, right. These type of places, which not uncommon things, just with what you do and how you do it. And,
right.
Sort of I guess the tips and tricks and the other things that you can do to try and make these, to maintain as much as you can. Maintain
right.
your mobility, maintain your activity.
Right. Oh, that's great. So what I'm really interested in, before we kind of get into the meat of the matter of talking about arthritis, is where you work. I was not aware that there was another orthopedic center here in Westfield. So tell us a little bit about how that came to be, exactly where it's located.
So we're on 53 Southampton Road. So it's in the Tig and Bond building. It's on the first floor there.
Oh, it's actually in the Tig and Bond building.
Yes.
Okay.
So
it's funny because I see the address and I'm thinking, where the heck is that? And I'm trying in my mind think about what's up there. I never thought about the Tig and Bond building.
Yes. It ended up being a great space. It was a medical office prior to this.
Oh, wow.
And it's actually a terrific space. Works out very well. First floor access, so as you can imagine, with stairs are not something that are welcome to all of our patients. So it actually works out very well from a number of standpoints.
Yeah. And when did you actually open?
We opened June 2nd this year.
Wow. So how did this come about? This is
So this was an idea that I have two partners who we've talked about this for some time, and the idea behind this is it's the urgent care aspect. It's the getting seen in a more timely manner.
Right.
This is one of those things where it's always frustrating that you'd see patients, and as I'm sure experiences you've had, that somebody calls and it's a problem that you already know about. You generally have a pretty good idea of what you're going to do, and then it takes 6 to 8 weeks to see you. The problem is that you're dealing dealing with pain throughout that period of time and the limited mobility, all the other things that go along with it. So the idea behind this is how can we improve upon that? How can we get you a reasonable evaluation orthopedically for either an acute injury or a chronic problem or something of this sort? And how can that be done in a better fashion? And so with this, the walk-in aspect of it allows you to do it essentially on your clock. That you have pain today, we'll see you today. So it's something that you call, you have this problem, and we'll see you on the same day for it. And you can't always fix these things, obviously, but at least get you started in the right direction. Get you a reasonable diagnosis, reasonable workup, X-ray, injection, brace, therapy, wherever we need to go with this, and kind of move on from there.
Do you have to have an appointment, or
No.
do you literally just walk in?
We don't do appointments. So this
You
is
don't?
walk-in only. No, this is walk-in only. So this is the difficulty that we would have with appointments is that people run late for appointments, no-show appointments, things of this sort, so it just never ends up happening. So I know if you're there, this is something that you're looking to be seen that day, and this is kind of what we're looking to be able to provide.
Of course, the danger of that is you could have an overabundance of people showing up at the same time. Is that ever an issue for you?
This can be. When we first open, we do evening and weekend hours. So in the evenings especially, a lot of people show up at 4, which is fine. We were able to get everybody seen fairly efficiently through all these processes. But that's the downside to it. But alternatively, the waiting 6 weeks or waiting for whatever length of time in an emergency room for an orthopedic evaluation ends up being much longer than we'll measure it in minutes. Not days, weeks, or hours. So
Yeah, that's true. Well, that's interesting, though. So there's no appointments. You just walk in if you've got an issue. Mm-hmm. And then what are the days of your operation? When are you
so we're
open?
7 days a week.
You are?
So
Wow.
Monday through Friday, we're open 4 p.m. to 8 p.m., and on Saturdays and Sundays, 8 a.m. to 1 p.m.
Wow. That's really impressive. I'm going to, next time do you have a sign outside?
There is. There's a
Okay.
sign on the road. There's a signage for the building itself, but not on the building. It's just in the front.
Oh, that's great. Next time I drive up that way, I'll take a
Yeah,
look. I
take a
just
look.
I honestly had not noticed that.
We've got a bigger sign.
Yeah, I know. No, it means I'm paying attention to my driving
That's the other thing we
instead.
want you to do, yeah.
I'm not looking around, which is unusual for me. And this is not part of New England Orthopedic Surgeons in Springfield that a lot of people think of. So this is an independent entity.
It is. It's so for this we still refer to and have a relationship with, but it is not owned or operated by. No.
Okay. And so let's talk about the kind, you've already delved into it a little bit, but let's talk a little bit about the kind of care that you would expect to see and what people should expect to be able to have taken care of at your place, or what they shouldn't. I mean, are there things that maybe people can't get taken care of at your place? They should be going right to the hospital.
Well, there's always certain things that that can't be handled in this setting. For this open fractures, bone poking out. For this, we're not going to be your source of.
Okay, that's right.
Yeah, these types of things. But in terms of for anything that generally comes under the category of orthopedics, as far as X-ray we have on site that we perform there.
Oh, you
read
do?
Interpreted. Mhm.
Okay.
So for things like joint injection, if that's where it goes, if that's something that you require, bracing or splinting, reductions, hand, wrist. We've done some shoulders, a couple of ankles. These types of things we can reduce and splint. So what we don't handle is the surgical aspect of this.
Okay.
So we coordinate with a number of local orthopedic practices, and are more than happy, and we get you referred to where you'll need to be. But at least to get you treated, diagnosed, stabilized. So we can send you for an MRI. We can perform all these types of things.
So you're not ongoing care. In other words, I come into you because I've got an issue, you diagnose it, and then I say, well, I'll be back here in a month and see you again, and just like I would in a regular doctor's office.
No, it's not exactly that. It's more of an urgent care model in that regard.
Okay.
It's not that. So people do show up for the same problem more than once. So let's say if you have knee arthritis, you can get an injection. You can't get an appointment with your regular orthopedist, or it's something where, for convenience sake, doing it that way. But when it comes to anything surgically, that we do not handle. handle.
Right, but you're not a scheduled, okay, I'm going to see you every
Correct,
month at
correct. Yeah,
Monday
yeah.
at 4 o'clock.
If you want to come back in 3 months, then you show up again in 3 months. So
Right.
yes, but there's not a scheduled aspect to it at this point.
Okay, so really urgent care is the key word there.
It is. It doesn't always have to be urgent injuries, but in
Okay.
terms of the care, absolutely.
Okay. And do you accept health insurance plans?
All major insurances, all major local insurances are accepted.
Okay.
Yeah.
Okay,
yeah.
so that's not an issue at
No,
all?
no. It would be the same as going to your regular doctor's office or regular urgent care, things of this sort.
Interesting. So let's talk about joint health and how people can stay active and confident as they age. I guess, and I guess the first question I kind of want to dive into is, what is arthritis? We all hear about it. Some of us are afflicted with it more than others. But what is it, and why is it that it shows up as you get older?
No, that's a great point. It's like I say, because we talk about it regularly, but we don't always have a great idea in terms of what it is. So what arthritis is, in osteoarthritis, so it's a wearing out of the articular cartilage in your joints. So where all your bones come together, it has a cartilage that coats the joint that helps with everything to glide smoothly. So if you think of it sort of like a tire, it gives you a general idea, but in the same way that wear and tear happens, it's the same idea, that over time and with use, and sometimes with injury, it damages that cartilage. And the difficulty with cartilage is that it doesn't have a blood supply, so it doesn't have a regenerative ability. It doesn't heal. So the trouble is that once it's gone, which is why as we age, it's something that wears out. It's that tire's not getting more tread on it as time is going on. Things can be repaired, replaced, maintained, but there's no way to make more of it. And that's where the big problem with it becomes, which is where treatment is maybe the wrong word as far as that goes, because we can't fix, but maintenance. So what you're doing is you're trying to make the situation as best as it can be in terms of maintaining your mobility, maintaining your activity level, everything in that regard.
And are some people, I mean, I see people that are much older than I am out there just going great guns like they're 20. And then there's others that are really crippled by it. So you see the extremes.
Oh, absolutely. And there's different kinds of arthritis. And the kind of arthritis we're generally talking about here is osteoarthritis. That's regular wear and tear arthritis.
Okay.
There's other things like rheumatoid arthritis, but those are more autoimmune driven. So that's a very different type. It has the same degradation that goes along with it of the cartilage, comes from a different source, and there's a lot of different kinds of treatment. That you'd see more of a rheumatologist for.
Okay, so you're focused on, say that kind of arthritis?
Osteoarthritis.
Osteoarthritis.
Okay.
Okay.
Yeah, and which is the general type that you think about when you talk about arthritis, kind of the wear and tear phenomenon.
Okay, that's interesting. So does catching, well, here's the other question. Can arthritis start at any age, or does it tend to 50, time to be arthritic?
Everybody's a little different because it has a lot to do with your genetics and has a lot to do with history. This is the kind of thing where, if you think about it literally from a wear and tear phenomenon, if you had an injury to a joint where that cartilage was injured and doesn't repair, then it doesn't necessarily get worse at that point, but it starts out then as time goes on becoming worse. And there's some people who are very gifted and very lucky. They get to thank their parents that they have a stronger kind of cartilage that doesn't have the same deterioration or breakdown. That's why two people who have very similar body habits, lifestyle, injury, everything of that sort, can have two very different paths as far as where that goes. The part of it but the difficulty is you can't control that part. You can only control sort of where you are. So there's not an absolute time where these things all start, but eventually you live long enough and it catches everybody.
Right. So there's no way to tell if you are going to be afflicted by it, but chances are good you're going to have something.
At some point, yes.
Right.
Yeah. So no, there's no marker or something that tells you ahead of time in that regard.
And can you catch it early? Does it make a difference if you're able to catch it early as far as its progression of how serious it becomes?
Well,
or is that even possible? Does it just sort of one day you've got some aches and...
Well, that's how it lets you know. That's the way everybody kind of discovers they have it, is pain is the first kind of symptom that you get that goes along with this.
Right.
And that's the big thing that alerts you to the fact that there's something that's going wrong. And it doesn't always take an event or an occurrence or an injury for that to be the case. So catching it early can be a good thing. So there's nothing nothing that you can do to reverse it, but there are things that you can do to slow the progression, and those are the kinds of things that you focus on. Some of those things are activity related. Some of them are personally related. This is the kind of thing where exercise and keeping of a normal body habit is these kinds of things where it helps. It helps in terms of that maintaining the larger truck you have, the more those tires get wear. And honestly, the rougher you do some things. This is where some people big runners have always been big runners for these kinds of things, but once you start to get that joint deterioration and these types of things, it's not so much stopping doing everything. It's sometimes pivoting or adjusting. It's more of an activity modification than it is not doing it. If you say, I love running, but my knees don't do that well anymore, then how do you feel about cycling? How do you feel about progressing to a different activity? Because mobility is a good thing. Mobility it's something that you don't want to stop, because once you stop, you lose a lot of these things, and it's not always something you get back.
Right. I've always been very athletic in my life, and I loved athletics because in physical activity, that's where I always felt the most alive, quite frankly. It was in training for a race, or actually in a race, whatever. It might be a canoe race or ski race, running race, cycling. I was doing a lot of that kind of stuff in my younger years. But I can't even begin to think about training at the same level or doing the kind of distances or the level of intensity and impact that I once did. I look at myself as kind of a shadow of what I used to do, but I still try to get out there and do it. Is it important to still be able, no matter what you're able to do, is it still important to get out there and do?
Absolutely. That last part that you mentioned is one of the most important things. It's not comparing you to you 20 years ago. It's comparing you to you yesterday. And it's the kind of thing of just literally keeping moving. And sometimes you do. You have to pivot and adjust what you're doing or how you're doing it. Because with all things physiologically, it breaks down with time. And so for this, we're never going to be who we were when we were 25 for these types of things. But it's continuing to run that race, even though the race is not going to be as fast, as long, or what it was before, but continuing to have those goals. Because exactly as you mentioned, is having something to train for. You're not training at the same level or in the same way, but you still have something you're training for, and maintaining that drive and that mobility are very, very important in terms of what you're doing. But as far as everyday life, just being able to get up the stairs, to be able to lift that box, to be able to do these kind of regular things, and doing all this other activity drives that ability, and being able to continue doing so.
And I think that's an important point for our viewers, is the fact that, being fit or in working out, exercising, it isn't just about, for some of us who are more competitive, but it is for everyday activity. It's for the ability to carry your groceries. I spent the day yesterday raking leaves, and I'm a little sore from that. I'm up on the ladder doing the gutters. I said, wow, I got to work on my thighs. And it's bending over, it's picking up, it's just moving around, but it's everyday activity. And that's why it's so important to keep our bodies as strong as we can.
Absolutely.
And to make sure that you're getting regular exercise and stretching and making that part of your lifestyle. Joint pain, is that expected that that's going to be a part of aging?
At some point, yes.
Right.
At some point, there's no way to avoid that there will be some degree of joint achiness and stiffness and these types of things. And it's more of the what can you do about it? How can you minimize it? How can you continue being active when those things afflict you, and when that becomes the case?
A lot of times people talk about being stiff in the morning. Oh, I'm so stiff, I got to loosen up. What is that from? Is that muscles just?
Well, it's actually muscles and joints, that as we age, we also desiccate a little bit, that we dry out. And so for some of these things, it's having some of those aches and pains that leave things in a fixed or certain position. So how your cartilage works in terms of how it gets nutrition is it doesn't have a blood supply. So it's kind of like a sponge. By moving it, what you're doing is you're squeezing the sponge, and it gets its nutrition from the surrounding synovial fluid. So that's how it's enhanced, which is why the term I think that you brought up before we were talked that motion is lotion is very true. That doing something with it, that a lot of times you'll stand up after being seated or in the car for a period of time, and you'll need a couple of steps to get going. So very normal thing to expect, but also something that developing a plan to deal with. Stretching routines, these kinds of things to try and limit that stiffness for either the duration or the extent of.
It's interesting. I have a very tight body. I always have ever since I was a kid. And as an adult, I have incorporated stretching. I've been doing this my entire adult life. 7 days a week. And before I even get out of bed, when I wake up, I am pulling one leg up to my chest, the other one, both of them, just to kind of get things moving again before I even sit up and step out of bed. But it is about stretching and just kind of getting your body ready.
Harry, you're the model for these types of things. This is literally the kind of the advice that you give and the ways that you go about this. Is that before you get your day started, you get your day started. This is the kind of thing where you're loosening up your joints. You're getting ready for that initial getting out and getting going. Something that we don't have to do when we're very young, but as time goes on, you have to more prepare for these types of things. And so for this, no, that's exactly what you're looking to do.
Yeah, no, it's funny. I brush my teeth, I shave, and then I'm on the carpeted floor. We have a large bathroom, and I'm doing stretching exercises just to get going before I can go anywhere.
Exactly, as you mentioned, though, it's part of your morning routine and maintenance, and that's how it becomes most effective, is when it's something that you already incorporate into the rest of the things that you do. Exactly, as you mentioned, you brush your teeth, you shave, you stretch, and these are the kinds of things that keep you as mobile as you are and able to do as much as you can. I know you criticize yourself for not being not being able to race 35 years ago, but this is the kind of thing where nobody can, and what you're able to do is you're still getting out there, you're still doing these activities, and that's should be the take-home message and the key to all of this.
And that's a reminder too for all of our viewers, is that make sure if you're not being physically active, make sure you build that into your lifestyle. Get some stretching. We do a lot of those kinds of programs at the senior center, so you can go and you can talk to Tina, to Carol Palmer, and learn what kinds of things you should be doing. But it is important to make it part of your lifestyle. So don't say, oh, I don't have time. Everybody has time. And when we're taking care of our bodies, we need to make sure we make that time. That's for sure. So remaining active, I think we've already been talking about that. You said is really the best thing you can to do for your joints. If you're feeling stiff, don't just sit down and sit all day long. You've got to be up, moving around, walking.
Absolutely. I mean, resting as you need to is important, but the saying when you don't use it, you lose it is absolutely accurate. Because you can keep what you're doing in terms of the stretching, the mobility. For all these kinds of things, you can't overcome it completely. You'll never make it so it's not the case. But what you can do is you want to fight the fight as much as you can, because you want to keep as much as you can for as long as you can. And these are sort of the goals that just sitting, especially with arthritis, this is something where stiffness and soreness sets in, where initially feels good to do so, but it becomes its own problem after too much, after too long a period of time. And this isn't, measured daily, and it's the kind of thing where if you have been doing, it's always something that you can be, every day is a new day that you can begin to go in a different direction. And it's the kind of thing where people aren't, if somebody's been very mobile for the last 5 or 6 years, they're not going to wake up and be able to do your routine. But it's not that. It's starting at your own pace. It's starting that, moving it along. It's just taking those steps and continuing to take those steps.
Right. And I want to just re-emphasize again for our viewers that, just gentle motion. It doesn't have to be anything excessive.
Absolutely.
But it's just really helps keep your joints healthy and flexible.
This is not talking about, waking up and doing a 5-mile run every morning. This is gentle stretching. This is, getting your body moving, getting all your joints mobilized, warming everything up. Just literally preparing for your day.
I've really become a fan of, as I aged, I loved running, but my knees started becoming a real problem, and it was that impact. So I've become a real fan of low-impact activities, cycling, cross-country skiing, walking, love to walk, because it's less of an impact on the joints. Is that something that you promote?
Absolutely. The term for it is activity modification.
Swimming?
Yeah. These are great things to do, and this is exactly the advice that you give for in these circumstances, where you can't always do the activity you did before, but you can do something. And like I say, so swimming's great because we're all more buoyant in the water. Not everybody has access to a pool, so it can be difficult. But cycling instead of running, walking instead of running, this is something where you can always do something, figuring out something that you're able to do.
One of the things that I love seeing, and I always said I need to do that, but I was always the competitor, but you see these running races, and there's a huge walking component to these now. And I love that because there's a lot of people who can't run, but you can go walk. And it really gives you a goal and motivation to get up and do this, because you say, well, I'm going to go be part of the turkey trot or whatever it is.
Absolutely.
Just walking with your friends, and you're just wearing your street clothes. You don't have to do anything special.
Well, you still get to participate and
But you get to
compete.
participate,
And this
right.
is the kind of thing where having goals is always an important thing. 'Cause
Right.
what it does is it gives you a deadline. It's
Right.
not something where you say, well, I'll start it next week.
Right.
You go, no. This race comes up at that point, and you know that if you're not doing anything to prepare for it, that it's
Right.
not going to go well, or you'll avoid it. So having those kinds of goals, and exactly that you don't have to say, well, I'm not going to win the race, therefore I'm not going to participate. Always participating, because who you're really competing against is you. You're
Right.
competing against you yesterday, and this is the kind
Right.
of thing where you're not to your left or your right, because that's not going
Right.
to really help you. It's
Right.
just participating in these things and continuing to show up.
Right.
Showing up every day. It's a big part of life.
And again, I think the word participation is the key word here. You're not necessarily competing with other people, as Tim says, but it is about participation and making sure that you're not just sitting around. And if things do hurt, it's important to get out. A lot of times, just physical activity, something may hurt when you first get up, but once you get things loosened up and you've been moving and stuff, that pain goes away, and you're able to carry on your everyday activities much easier.
Sure. And there's lots of treatments that can help with these types of things. I mean, even things like joint injections, physical therapy, sometimes bracing, and these types of things can all be helpful adjuncts to making you able to participate in those activities. Again, not always at the level that you may have done before that you would like to do, but getting you out there and getting able to participate and getting started. Absolutely.
Yeah, interesting. So I guess I think I know the answer, but I'm going to throw it at you, because this is important stuff to explore. People who are afflicted with arthritis shouldn't feel that their lifestyle has come to a stop or they have to change. They can still keep going. They've got to learn how to adjust, but they don't need to. Their life hasn't come to an end because they're now got arthritis.
Correct. This is the kind of thing where you do have to change your mindset a little bit in terms of what you might want to do or what those goals might look like. But not stopping is kind of one of the important parts. That this is something where it's not that I can't do X anymore, so therefore all of it's all over. You have to find that Y, that Z, that other activity, because there's something that you can do, and that's what you want to keep doing.
Right. And joint problems, a lot of times we hear about knee replacements. I have a hip replacement, those types of things, and people say, oh, I don't want to do that. But are joint injuries able to be managed through physical therapy or exercise or other types of vehicles before surgery's even
Oh, absolutely,
an option?
absolutely. This is the kind of thing, especially for replacement, that you really want to exhaust all your conservative management options, because if you have a bad knee, if you have your knee done tomorrow, or if it's done in 5 years, it's a knee replacement. The surgery doesn't always change that much, but if you can maintain the same mobility, the same activity level, the other difficulty is that it's the assessment of risk. That there's a certain amount that comes along with more invasive procedures, these types of things, and so you can't always completely escape these things because it's not a condition that's curable. But putting off that for a longer period of time, what you win in the meantime is you have that time that you're able to continue participating in these activities. You're able to continue doing these types of things.
Right. I want to talk a little bit about, we always hear about cortisone shots and injections and gel shots.
Sure.
What are those? What is cortisone? What is gel? And what is it doing? And are there any side effects to that?
Of course.
Down the road.
So cortisone is a steroid. It's the same as you take orally. It's just an injectable version of. So it's an anti-inflammatory. It's a very strong anti-inflammatory.
Oh, okay.
So the basis of a lot of the pain that you have in your joints is usually inflammation. It's, the breakdown or wear causes friction. Friction causes inflammation. That inflammation thereby causes pain. So what the steroid does, it helps to break up that inflammatory cycle. So what it's doing is it's settling down the inflammation that you have. So this is one of those things where you hear a lot of people talk about this, and they say, I had a knee injection and it lasted 5 years. It didn't. It lasted about 4 weeks. It took 5 years for that inflammation to come back. And that's the part where that's the question of how long do things work and how well do they work. It's what's driven by how strong is this product and how much can it help with this. Because again, it's not a cure. But what it's doing is it's taking away some of your pain and the inflammation in the interim. And then whether it's worthwhile to do again depends on how long and how well it works for you. So side effects with things like cortisone injections, a lot of times it can raise blood pressure and blood sugar for short periods of time. So if you're diabetic, it's something where you want to monitor these types of things. You can have these things called flushing responses where some people, your face gets warm, have a little bit of trouble sleeping, same as you take with an oral steroid. And it's not really an allergy, it's a side effect. It's something that passes relatively quickly in that regard.
Do cortisones, I've heard this, I don't know if there's any truth to it, that's the problem, you hear all these things.
Sure.
The cortisone, every time you have a shot, it has a shorter time span of effectiveness. Is that true or not?
It's not with every single shot, but over time it absolutely does. And the reason for that is that the disease process progresses. So it means that the amount of deterioration or breakdown that you have in your joint gets worse over time. So what happens is that the shot is no longer as effective because the disease is worse. And so that's what changes the efficacy. So the shot itself remains the same strength as far as this goes. It's just your body's deterioration or breakdown has become worse, therefore it's not always as effective. So it's not something that marches along exactly, but if you measure it over time, absolutely. This is something where it becomes less effective, which is why joint injections that used to last for months or years now last sometimes weeks or months. And that's where it gets to the point where it's not as effective or effective enough for you anymore that it's a good or viable treatment option. And that's where starting to talk about things like surgical options become the case.
What is gel? I've heard people
gel
talk about gel, and is that the next best thing, or is that an option, or is that something entirely different than cortisone?
It's different than cortisone. So so viscosupplementation is the general term for all of these types of products. There's lots of different companies that make it, and the idea behind that is different than with the cortisone. The idea behind those is to actually, it's kind of like an oil change, where all your joints have a joint fluid. It's a synovial fluid. With the idea behind the viscosupplementation or gel injections is that they thicken that joint fluid to make a more viscous environment. By being more viscous, there's less inflammation. By less inflammation, thereby less pain. So works differently for everybody. And that's one where the biggest, so those don't tend to affect blood pressure or blood sugar, which is an upside to it. The problem is it's not always as effective. It means that it doesn't help probably as large a group of people as cortisone does.
Oh, really?
Sometimes the people it affects for longer periods of time, which is terrific. But there's also a higher rate of people it just doesn't do much for. It doesn't do you harm to get it, but it just doesn't give you any help. Sometimes you get so those sometimes come as a single shot or a series of shots. And this is the kind of thing sometimes you get to the end of the point where it should be giving you the effect and just nothing's happening. And that can be the case. Those are also can be repeated. So general rules for it is that cortisone shots can generally be repeated every 3 months as they're needed. And the viscosupplementation or gel injections can be repeated every 6 months as they're needed.
Okay.
So you need to space them out from themselves, but not from each other. It means that you can get a gel injection and a cortisone injection within a short period of time, but you can't get a gel injection and a gel injection within a short period of time for cortisone. So they work in different ways.
Okay. And at what point does surgery start rearing its head in the diagnosis of, we start with management, so kind of the progression of management of arthritic joints?
Sure. So my idea behind this is that you do as little as you can to make you as pain-free and as mobile as you can be. And if that's going to be something as easy as just some gentle stretching, then you stick with that. If it comes to the point of oral medications, well, those all have risk as well. And so you sort of weigh the risk and benefit ratio, and then goes on to therapy and bracing and injections. And when all of those things are unsuccessful, that's where you start talking more about surgery. So surgery becomes kind of a culmination of radiographic or radiologic findings that you have enough disease that it's worthwhile to do, and your lack of response to treatment. And that's what kind of you figure out when is it the right time to really start strenuously considering or really start planning on moving along in that regard.
So you don't have to, just because you're starting to get an onset of arthritis, that doesn't mean that you're immediately headed towards surgery or replacement joints.
No. The duration of time it takes for most of this is measured in years and oftentimes decades. So this is kind of thing where sometimes it can progress quickly, but generally progresses a little bit more slowly than that. And as long as you're monitoring it, so getting occasional radiographs, so it tells you kind of where you are, and then your symptoms certainly tell you how much you're responding or how much you need to do. This is something if you have a terrible looking joint on X-ray, but it really doesn't bother you that much, then it's not a great idea to replace it, because the only endpoint you're chasing is pain. Pain is really the endpoint of was this successful or not. So if you're not having pain, not a lot to offer.
Okay. Okay. And I'm guessing that the surgical techniques that they use for joint replacement today have come a long way
Oh,
in the
absolutely.
last 30 years, 20 years.
Absolutely. The ideas behind it are still the same as they were initially, is that you take something that you feel that has nerve endings and you put something that is a different substrate or structure that does not. And by giving that some degree of mobility and making that work, that's the idea behind it. So the materials that are used, the techniques that are used, everything of this sort absolutely has come quite a ways. You had mentioned you had a hip replacement. This is the kind of thing that, 25 years ago, you'd be in the hospital for 4 or 5 days. You'd then go to rehab for a week or two. At this point, a lot of people are going home the same day. A lot of things have improved. Anesthetic techniques, surgical techniques, materials, all these kinds of things have gone along with that. But the ideas behind it and the reason for doing it are still the same.
Yeah, interesting. Let's talk about nutrition and hydration. How does that affect joint health?
So hydration, as I mentioned before, we all tend to, we desiccate to some degree as time goes on, which is why certain types of tears can happen easier, these types of things. So keeping adequate nutrition from a standpoint of body habitus as well is also very important. This is the kind of thing, like I say, the heavier the truck, the more wear on the tires. This is the kind of thing by doing that and by getting appropriate nutrition in terms of vitamins, minerals, appropriate amount of proteins, these kinds of things, all helps to maintain muscle and joint and bone health.
Yeah, that's a great point, and I love your analogy to trucks and tires.
No, some people are subcompacts. This is
You're right.
not all trucks. This is
right, but the point is that we do need to watch our weight as we get older because we tend to put on weight, but we need to do it because the heavier we are, the more. The more stress we put on those knees.
Exactly.
And
the
those
more
hips.
wear and tear that you put across
Right.
these joints as time goes on. Absolutely. Absolutely.
Right, yeah. Well, I'm just curious from a standpoint of either knee replacement or hip replacement, is it like 6 weeks of recovery? Is that still the kind of standard, or does that really vary by person?
It varies a lot by person. So it's a year until you're as good as you can be. That's
Okay.
when you'd consider truly an endpoint of if it's not happening at this point, it's not coming. You do the vast majority in that first 6 weeks. So the first 6 weeks is when you're doing a lot of the hard work that goes along with it. Anybody who's had a knee replacement can absolutely attest to all that hard work, and that's what pays off in the end. But really for that first 6 weeks and then at the 3-month mark, you're generally able to get back to most of the regular activities that you were doing. But like I say, for soft tissue healing and everything else, which is a large part of these procedures, it really is a year until that's as good as it can be, because a different type of healing that goes along with it.
Or is it true that knees generally are more difficult to recover from than hips?
Yeah, knees are a tougher recovery. It's just because the therapy is a tough part. That what you're fighting against is your own healing. What your body's trying to do is put down scar tissue. What happens is that the mobility of your knee gets hindered by that, and what you're doing is literally breaking up that scar tissue. And so literally it's as much fun as it sounds. Hips don't tend to get stiff the same way, which is it's great because you don't have to. It's not that hips are easy by any means. Still the surgical pain, everything in that regard. And the therapy involves a lot of strengthening and these types of things, but it's not always the mobility work that goes in with the knee. And that's what makes it a tougher recovery and usually a more painful recovery. And anybody who's had both can usually attest to the same.
We hear that term scar tissue a lot. Always hear that. What is that?
So scar tissue, when you break your bone, the good news is you heal with more bone. It's the same type of tissue. So bone heals with more bone. With soft tissue and everything else of that sort, it doesn't. It heals with scar tissue, which is a thicker, more fibrous type of tissue. It doesn't have the same type of elasticity and it doesn't have the same properties, which is where it takes a longer period of time to heal because it has to mature, it then has to be stretched, it then has to go through strengthening phases that go along with this, which is a big part of why the soft tissue healing of a lot of things takes a lot longer.
Let's talk a little bit about just what people are eating and drinking and how that affects inflammation, because the type of foods you have has a lot to do with what's going on in your joints. And
So for a lot of these types of things, people talk about eating anti-inflammatory diets, things of this sort.
Right, I hear about that a lot.
So it's so a lot of it. Now I haven't seen great research in terms of how much it affects joint and bone health. A lot has to do with gastrointestinal health, these types of things. People have inflammatory conditions of that sort. How much it trickles down to that? It has to some degree, but in terms of quantifying how much, it becomes a little bit difficult. So to say authoritatively with what types of foods are going to be very good for this and how much, and then to what degree of help you can expect. I think that's the part where research is going to bear that out at some point as far as better recommendations in terms of what to do. At this point, eating an anti-inflammatory diet is generally considered to be a good thing, but how much, what to have, and then how much help you can expect from it. That's what still sort of wait and see kind of where research takes you in that regard, because good research takes time. It's difficult to be able to say that one thing helps more than another. Because you have to have a well-designed study, a group of people who adhere to, and then to be able to sort of monitor and measure, and then for it to be statistically significant. So that for all these types of things, I think it certainly will have bearing on that, but I'm not sure if there's great answers to this point to how much and to what degree.
Yeah, that's interesting. But people can still expect to live an active life even though they've got joint pain.
Absolutely.
Life doesn't stop just because, my joints are so bad.
No, not unless you let it. This is the kind of thing where it does.
I think that's a key point, unless you let it.
Yeah, this is not something where, so there's not magic to it. I wish we had a wand that you said, no, this just gets to be better. But it takes a dedication, and it takes an active effort on people's part in order to make the most of what they have for as long as they can. And that's the whole thing. It's having the mindset that what you're trying to do is keep as much as you can for as long as you can, because what we're looking for generally is the mobility that goes along with this. I know you want to be able to still canoe race and ski race, but the whole thing about this is you also want to be able to walk up the stairs, and being able to, and training for these types of things prepares you for the other. And so trying to work on these things and make a regular and concerted effort to do so, and that's where it becomes nobody can do it for you. This is having to do it yourself. So you can get great guidance. There's a lot of things that can be done to help in these types of situations, but a lot of it it comes down to you having the getting the information and the help that you need, and then instituting that, having a plan going forward as far as a regular stretching routine, a regular exercise routine, keeping these things as much and as well as you can.
And is it? And I think we've kind of covered this a little bit, but arthritis is a progressive thing. It's going to continue to get worse. It doesn't kind of plateau and stop.
Yes.
It's just going to continue to get worse.
It's a chronically progressive condition where it is today is not where it's going to be in a year. Yes.
Yeah, that's what scares me.
Yes, that's the tough part. That's the tough part.
But the key is stay active and make sure that you're still doing stuff.
Absolutely.
So I think, as we kind of wrap up here, people should expect to be able to continue their lifestyle, whether it's swimming, skiing, cycling, walking, whatever it is that you get joy from and that keeps you active at whatever level, you should still pursue that.
Absolutely. This is the kind of thing where not stopping with these types of things becomes the key. Again, understanding that you can't do it at the same level all the time. This is the kind of thing where understanding that there's going to be some limitations that come along with this, and sometimes it's intensity limitations, sometimes it's time limitations, but still doing so. And then when you can't always do the activity that you enjoy so much, there's something else that you can do. There's something else to take its place.
Right. Tim, this has been a fascinating conversation. Before I wrap up here, I want to just make sure that people understand you are in urgent care. So I want to just talk a little bit again about when should people be thinking about you? When should they be thinking about the hospital? When should they be thinking about a more structured place where they're going to get into regular appointments, like New England Orthopedics in Springfield?
Sure. So this is the type of thing that if you have bone, joint, or orthopedic problem that requires evaluation, then coming in to get going in the right direction is absolutely fine. So the idea behind this is not to do the same thing as New England Orthopedics does, because what they have is that structured part of it, but that's sometimes the part that becomes getting in that front door becomes the difficult aspect. And this is the part that we're looking to help with, is not taking over all of that care. It's getting you going in the right direction, getting you a good advice and a good evaluation to get you going in the right direction. So if you just had a car accident, the ambulance picks you up, coming to our facility is not the right way. This is something that it needs that different kind of evaluation. But if you had an accident yesterday and your shoulder's pretty sore today, come in. This is the kind of thing where we can get a good look at you, get a good evaluation, get you a good plan in terms of where to get started, and then refer you to where you might need to be.
And I would think, too, that this, in the work that you're doing, pertains to all ages. So this could be high school athletes, any college athletes. It could be anybody that's got an issue, just amateur athletes just involved in road racing or whatever they might be doing, just normal everyday aches and pains.
Orthopedic issues literally happen from cradle to grave. This is the kind of thing where there's obviously different types of injuries and different processes of, but absolutely traumatic injuries. We see kids all the time. This is something that high school sports, adult recreational sports, kids slip and fall in the park, these kinds of things. All of these can have a evaluation in that regard.
Right, and I guess I would equate it, and you can let me know if I'm wrong on this, that what you're doing is similar to what we see with an urgent care center for just medical emergencies. It's you go to a doctor's office, first of all, you may not get an appointment, or you may have to wait. If you go to the emergency room, you're going to have to wait. But if you go to the urgent care center, you can get right in and get somebody to look at you. You're the same thing, and it's great for evaluation and determining what your next steps are.
Absolutely, that's exactly the case. Where what it allows is, the only difference is, like I say, the only thing we provide evaluations in is orthopedics, because that's where our expertise lies. So again, for these types of injuries, it gets you that initial evaluation, hopefully in a much more timely manner than you get in other ways, and then sort of getting you pointed in the right direction as far as what the next steps might be. Is there another test or evaluation that can be ordered, that can be done in order to kind of prepare for that next step, and all these types of things. And the same type of thing where you get a lot of, you have a vacation coming up and you call for your knee injection. You say, they can't see me for 6 weeks, I'm going to be back for my appointment in 2. Then stop in. We're more than happy to kind of help you in that regard. Absolutely, absolutely. Looking for people to really be able to participate and enjoy their lives as much as they can by limiting the pain and the limitations that sort of pain and swelling, those difficulties provide, by being able to alleviate that, and just by being able to do so on a faster basis. Again, not taking over the ultimate role of this, but if this is something where you need it now, this is something where we're able to provide that service.
I'd say we're lucky to have your facility here in Westfield so that it's so convenient to all of us. Tim, we've covered a lot of ground here, and I really appreciate your expertise. Is there anything that we haven't talked about that you would like to just share with our viewers?
I think for this, I think we've given them a lot of food for thought and a lot to chew on as far as this goes, especially in terms of joint health and just getting started in that direction. I think, we can't reiterate, as we have a number of times, the importance of showing up, participating, continuing to sort of be active. I can't stress that enough, because the whole key to doing this as well as we can for as long as we can is continuing to make a concerted effort to do so. But no, I think it's been terrific. I think to be able to sort of share a lot of this and discuss some of these things, that having an understanding of what it involves, of the reason that it goes in that direction, and even just some limited pathophysiology of what that looks like becomes helpful. Just understanding what you have gives you a good sense as far as what you can do with it and how it's best to be treated. Yeah.
Well, Tim Rice, thank you so much. Physician assistant at Westfield's new Ortho MA Orthopedic Urgent Care Clinic, located at 53 Southampton Road. That's in the Tie and Bond building. And I think what's important that I hope you get out of this is the fact that I certainly have arthritis myself in my joints, but it's important to not let that stop you. You may not be able to do things at the level that you once could, but you need to maintain that quality of life that you expect to have into your older years. And it is about staying active, about stretching, finding things to do, but don't surrender to it.
No,
I think
no.
that's the key, is don't surrender to it. But if you feel you need to be evaluated, if you need some type of care immediately, such as a shot that, a cortisone shot or gel shot, that type of thing, they certainly are a option for you to look at. So again, Tim Rice, thank you so much for coming in. Love your knowledge base, and thank you for being a part of our wonderful community here in the city of Westfield. Don't forget that this program is broadcast on Westfield Cable Channel 15 every Tuesday and Thursday at 2:45. So if you want to watch it again, just prepare yourself for the following Tuesday or Thursday at 2:45, and you'll be able to do so. Special thanks to Pete Coles, our WCPC Westfield Cable Channel 15 producer and manager, for his help and support to keep this show possible. And on behalf of Pete Coles, Mike Squindo, and Tina Gorman, I'm Harry Rock. This has been another edition of the Westfield Council on Aging Presents. We'll see you on the next show. Have a great day, everybody.